51. What is the primary purpose of an angioplasty procedure? A. To replace a damaged heart valve. B. To widen narrowed arteries and restore blood flow. C. To treat arrhythmias. D. To control heart rate. Answer: B. To widen narrowed arteries and restore blood flow. Rationale: angioplasty involves using a balloon or stent to widen narrowed or blocked arteries, improving blood flow. It does not replace heart valves. A. Treat arrhythmias. C. Or control heart rate. D. 52. What is a common side effect of ACE inhibitors used in heart failure treatment? A. Cough. B. Hypokalemia. C. Weight loss. D. Increased heart rate. Answer: A. Cough. Rationale: a persistent dry cough is a common side effect of ACE inhibitors. They do not cause hypokalemia. B. Weight loss. C. Or increased heart rate. D. 53. Which type of heart failure is characterized by a preserved ejection fraction? A. Systolic heart failure. B. Diastolic heart failure. C. Acute heart failure. D. Right-sided heart failure. Answer: B. Diastolic heart failure. Rationale: diastolic heart failure is characterized by a preserved ejection fraction, normal or near normal, but impaired relaxation and filling of the heart. Systolic heart failure, A, is associated with a reduced ejection fraction. 54. Which of the following is a common consequence of untreated heart failure? A. Weight loss. B. Kidney failure. C. High blood sugar. D. Increased vision. Answer: B. Kidney failure. Rationale: untreated heart failure can lead to kidney failure due to decreased renal perfusion. Weight loss, A, high blood sugar, C, and increased vision, D, are not common consequences of untreated heart failure. 55. What is the role of the right atrium in heart function? A. To pump oxygenated blood to the body. B. To pump deoxygenated blood to the lungs. C. To receive deoxygenated blood from the body. D. To control heart rate. Answer: C. To receive deoxygenated blood from the body. Rationale: the right atrium receives deoxygenated blood from the body and pumps it into the right ventricle, which then sends it to the lungs. The left atrium, A, pumps oxygenated blood to the body, and the sinoatrial node, D, controls heart rate. 56. Which of the following medications is commonly used to treat hypertension in heart failure patients? A. Diuretics. B. Calcium channel blockers. C. Beta blockers. D. Angiotensin-converting enzyme inhibitors. Answer: D. Angiotensin-converting enzyme inhibitors. Rationale: ACE inhibitors are commonly used to treat both hypertension and heart failure by dilating blood vessels and reducing the heart's workload. Diuretics, A, reduce fluid retention but are not primarily used to treat hypertension, while calcium channel blockers, B, and beta blockers, C, can also help, but ACE inhibitors are typically first line. 57. What is the primary cause of aortic stenosis? A. Atherosclerosis. B. Infection. C. Age-related degenerative changes. D. Congenital defects. Answer: C. Age-related degenerative changes. Rationale: aortic stenosis is most commonly caused by age-related degenerative changes in the aortic valve, although it can also result from congenital defects, D, or infections. Atherosclerosis, A, and infections, B, are not the primary causes. 58. What is the primary treatment for hypertensive heart disease? A. Diuretics. B. Antiplatelet drugs. C. Beta blockers. D. Antihypertensive medications. Answer: D. Antihypertensive medications. Rationale: the primary treatment for hypertensive heart disease is controlling high blood pressure with antihypertensive medications, such as ACE inhibitors, diuretics, or beta blockers. Diuretics, A, and beta blockers, C, can be part of treatment, but are not the primary choice. 59. What is the effect of digitalis in heart failure treatment? A. It increases heart rate. B. It strengthens heart contractions. C. It lowers blood pressure. D. It promotes fluid retention. Answer: B. It strengthens heart contractions. Rationale: digitalis strengthens the heart's contractions, improving its pumping efficiency. It does not increase heart rate, A, lower blood pressure, C, or promote fluid retention, D. 60. What is the typical first-line therapy for chronic heart failure with reduced ejection fraction, HFrEF? A, angiotensin-converting enzyme inhibitors. B, beta blockers. C, diuretics. D, statins. Answer: A, angiotensin-converting enzyme inhibitors. Rationale: ACE inhibitors are typically used as first-line therapy for chronic heart failure with reduced ejection fraction, HFrEF, to reduce the heart's workload and prevent further damage. Beta blockers, B, and diuretics, C, are also important, but ACE inhibitors are first-line. Statins, D, are not used for heart failure treatment. 61. What is the most common cause of atrial fibrillation? A, coronary artery disease. B, high blood pressure. C, diabetes. D, valve disease. Answer: B, high blood pressure. Rationale: high blood pressure is the most common cause of atrial fibrillation as it causes structural changes in the atria. Coronary artery disease, A, diabetes, C, and valve disease, D, are less common causes. 62. What is the goal of using anticoagulants in atrial fibrillation? A, to increase heart rate. B, to prevent stroke by reducing blood clot formation. C, to control heart rhythm. D, to strengthen heart contractions. Answer: B, to prevent stroke by reducing blood clot formation. Rationale: anticoagulants are used to prevent stroke in atrial fibrillation patients by reducing the risk of blood clots. They do not increase heart rate, A, control rhythm, C, or strengthen contractions, D. 63. What is the primary purpose of a pacemaker in heart disease? A, to strengthen heart contractions. B, to regulate heart rhythm. C, to reduce blood pressure. D, to control blood clotting. Answer: B, to regulate heart rhythm. Rationale: a pacemaker is used to regulate abnormal heart rhythms by sending electrical impulses to the heart. It does not strengthen heart contractions, A, reduce blood pressure, C, or control blood clotting, D. 64. What is a major complication of long-term uncontrolled hypertension? A, stroke. B, asthma. C, diabetes. D, lung cancer. Answer: A, stroke. Rationale: uncontrolled hypertension can lead to complications such as stroke, heart failure, and kidney disease. It does not directly cause asthma, B, diabetes, C, or lung cancer, D. 65. Which of the following is a common symptom of right-sided heart failure? A, pulmonary edema. B, swelling in the legs and abdomen. C, shortness of breath. D, cyanosis. Answer: B, swelling in the legs and abdomen. Rationale: right-sided heart failure leads to fluid accumulation in the legs, abdomen, and other parts of the body, causing swelling. Pulmonary edema, A, and shortness of breath, C, are more common in left-sided heart failure. Cyanosis, D, can occur in both types. 66. What is the most common test to diagnose deep vein thrombosis, DVT? A, CT scan. B, ultrasound. C, MRI scan. D, X-ray. Answer: B, ultrasound. Rationale: ultrasound is the most common and effective diagnostic test for deep vein thrombosis, DVT, as it can visualize clots in the veins. CT scans, A, MRI scans, C, and X-rays, D, are not used to diagnose DVT. 67. Which of the following is a risk factor for developing deep vein thrombosis, DVT? A, physical inactivity. B, high protein intake. C, excessive exercise. D, low blood sugar. Answer: A, physical inactivity. Rationale: physical inactivity, such as prolonged bed rest or immobility, increases the risk of DVT. High protein intake, B, excessive exercise, C, and low blood sugar, D, are not risk factors for DVT. 68. What is the primary treatment for a pulmonary embolism? A, antibiotics. B, anticoagulants. C. Diuretics. D. Beta blockers. Answer: B. Anticoagulants. Rationale: anticoagulants are the primary treatment for pulmonary embolism to prevent further clot formation. Antibiotics, A. Diuretics, C. and beta blockers, D. are not used for this condition. 69. What is the main goal of treatment in chronic obstructive pulmonary disease, COPD? A. To cure the disease. B. To reduce symptoms and improve quality of life. C. To prevent all complications. D. To increase lung capacity permanently. Answer: B. To reduce symptoms and improve quality of life. Rationale: the main goal in COPD treatment is to reduce symptoms and improve the patient's quality of life. COPD is not curable, and treatment focuses on symptom management rather than preventing all complications, C, or increasing lung capacity permanently, D. 70. Which of the following medications is commonly used to treat asthma? A. Insulin. B. Bronchodilators. C. Antihistamines. D. Diuretics. Answer: B. Bronchodilators. Rationale: bronchodilators are commonly used to treat asthma by opening the airways and easing breathing. Insulin, A. Antihistamines, C. and diuretics, D. are not typically used for asthma management. 71. What is a common sign of pneumonia? A. Cough with phlegm. B. Weight loss. C. Joint pain. D. Headache. Answer: A. Cough with phlegm. Rationale: a cough with phlegm is a common symptom of pneumonia, along with fever and shortness of breath. Weight loss, B. Joint pain, C. and headache, D. are not typical symptoms of pneumonia. 72. Which of the following is a major risk factor for developing pneumonia? A. Smoking. B. Regular exercise. C. High-fiber diet. D. Consuming plenty of water. Answer: A. Smoking. Rationale: smoking weakens the immune system and damages the lungs, making individuals more susceptible to pneumonia. Regular exercise, B. High-fiber diet, C. and consuming plenty of water, D. are not risk factors. 73. What is the primary cause of tuberculosis? A. Bacterial infection. B. Viral infection. C. Fungal infection. D. Allergic reaction. Answer: A. Bacterial infection. Rationale: tuberculosis is caused by the bacterium Mycobacterium tuberculosis. It is not caused by a viral, B, fungal, C, or allergic, D, reaction. 74. Which of the following is a symptom of tuberculosis? A. Persistent cough with blood. B. Nausea and vomiting. C. Joint pain. D. High blood pressure. Answer: A. Persistent cough with blood. Rationale: a persistent cough with blood, hemoptysis, is a hallmark symptom of tuberculosis. Nausea and vomiting, B. Joint pain, C. and high blood pressure, D. are not common symptoms of tuberculosis. 75. What is the most effective way to prevent the spread of tuberculosis? A. Taking antibiotics as prescribed. B. Regular exercise. C. Wearing a mask. D. Avoiding dairy products. Answer: A. Taking antibiotics as prescribed. Rationale: the most effective way to prevent the spread of tuberculosis is to complete the full course of antibiotics as prescribed. While wearing a mask, C, is helpful in some situations, it is not as effective as completing the antibiotic regimen. 76. Which of the following is a common complication of untreated sleep apnea? A. Stroke. B. Asthma. C. Pneumonia. D. Gallstones. Answer: A. Stroke. Rationale: untreated sleep apnea can lead to various complications, including an increased risk of stroke, heart disease, and high blood pressure. It does not directly cause asthma, B. Pneumonia, C. or gallstones, D. 77. What is the most common cause of chronic bronchitis? A. Smoking. B. Air pollution. C. Bacterial infections. D. Asthma. Answer: A. Smoking. Rationale: Smoking is the leading cause of chronic bronchitis, a form of chronic obstructive pulmonary disease, COPD. Air pollution, B, and bacterial infections, C, can contribute, but smoking is the primary cause. Asthma, D, can lead to bronchitis, but is not the primary cause. 78. What is the main function of the alveoli in the lungs? A, to produce mucus. B, to exchange gases between the lungs and blood. C, to filter air. D, to regulate body temperature. Answer, B, to exchange gases between the lungs and blood. Rationale, the alveoli are responsible for gas exchange, where oxygen is absorbed into the blood and carbon dioxide is expelled. They do not produce mucus, A, filter air, C, or regulate body temperature, D. 79. What is the primary treatment for an asthma attack? A, antibiotics. B, bronchodilators. C, diuretics. D, corticosteroids. Answer, B, bronchodilators. Rationale, bronchodilators, such as albuterol, are used to treat asthma attacks by quickly opening the airways. Antibiotics, A, diuretics, C, and corticosteroids, D, may be used for other aspects of asthma management, but not for immediate relief during an attack. 80. Which of the following best describes a common symptom of emphysema? A, chronic dry cough. B, sudden weight gain. C, shortness of breath. D, fever and chills. Answer, C, shortness of breath. Rationale, shortness of breath is a key symptom of emphysema, which damages the air sacs in the lungs and makes breathing difficult. Chronic dry cough, A, can also occur but is less common. Sudden weight gain, B, and fever and chills, D, are not typical symptoms. 81. What is the most common symptom of a heart attack? A, chest pain or discomfort. B, nausea. C, sweating. D, leg swelling. Answer, A, chest pain or discomfort. Rationale, the most common symptom of a heart attack is chest pain or discomfort. Nausea, B, sweating, C, and leg swelling, D, can also occur but are less specific. 82. Which of the following is a major risk factor for heart disease? A, physical activity. B, high blood pressure. C, low cholesterol. D, regular exercise. Answer, B, high blood pressure. Rationale, high blood pressure is a major risk factor for heart disease as it can damage blood vessels and the heart. Physical activity, A, low cholesterol, C, and regular exercise, D, are generally beneficial for heart health. 83. What is the primary treatment for hypertension? A, diuretics. B, beta blockers. C, anticoagulants. D, antihypertensive medications. Answer, D, antihypertensive medications. Rationale, antihypertensive medications are used to lower blood pressure in patients with hypertension. Diuretics, A, and beta blockers, B, may be used but are part of a broader treatment plan. Anticoagulants, C, are not used for hypertension. 84. What is the first-line treatment for type 2 diabetes? A, insulin injections. B, oral medications. C, diet and exercise.
D, surgery.
Answer, C, diet and exercise. Rationale, the first-line treatment for type 2 diabetes is lifestyle changes, including diet and exercise. Oral medications, B, and insulin, A, may be used if lifestyle changes are not sufficient, and surgery, D, is not typically a first-line treatment. 85. What is the most common type of diabetes? A, type 1 diabetes. B, type 2 diabetes. C, gestational diabetes. D, maturity-onset diabetes of the young. Answer, B, type 2 diabetes. Rationale, type 2 diabetes is the most common form of diabetes, typically occurring in adults. Type 1 diabetes, A, is less common, and gestational diabetes, C, occurs during pregnancy. Maturity-onset diabetes of the young, D, is a rare genetic form. 86. What is the primary symptom of hyperthyroidism? A, weight loss. B, weight gain. C, cold intolerance. D, fatigue. Answer, A, weight loss. Rationale, Hyperthyroidism often causes weight loss due to an increased metabolism. Weight gain, B, cold intolerance, C, and fatigue, D, are more common in hypothyroidism. 87. Which of the following conditions is commonly associated with hyperthyroidism? A. Goiter. B. Hypoglycemia. C. Osteoarthritis. D. Liver disease. Answer: A. Goiter. Rationale: a goiter, or an enlarged thyroid, is a common feature of hyperthyroidism. Hypoglycemia, B, osteoarthritis, C, and liver disease, D, are not typically associated with hyperthyroidism. 88. What is the main characteristic of Graves' disease? A. Weight gain. B. Goiter and bulging eyes. C. Cold intolerance. D. Excessive urination. Answer: B. Goiter and bulging eyes. Rationale: Graves' disease is an autoimmune disorder that causes goiter and bulging eyes, exophthalmos. Weight gain, A, cold intolerance, C, and excessive urination, D, are not primary features of Graves' disease. 89. What is the most common cause of hypothyroidism? A. Autoimmune disease, Hashimoto's thyroiditis. B. Iodine deficiency. C. Hyperthyroidism treatment. D. Excessive thyroid hormone replacement. Answer: A. Autoimmune disease, Hashimoto's thyroiditis. Rationale: the most common cause of hypothyroidism is Hashimoto's thyroiditis, an autoimmune disease. Iodine deficiency, B, is a cause in some parts of the world, but Hashimoto's is more common in developed countries. 90. Which of the following symptoms is commonly associated with hypothyroidism? A. Weight loss. B. Rapid heartbeat. C. Cold intolerance. D. Diarrhea. Answer: C. Cold intolerance. Rationale: hypothyroidism often causes cold intolerance due to slowed metabolism. Weight loss, A, rapid heartbeat, B, and diarrhea, D, are more common in hyperthyroidism. 91. What is the most common cause of acute pancreatitis? A. Gallstones. B. Alcohol consumption. C. Diabetes. D. High-fat diet. Answer: A. Gallstones. Rationale: gallstones are the most common cause of acute pancreatitis, though alcohol consumption, B, is also a major risk factor. Diabetes, C, and high-fat diet, D, are not the primary causes. 92. What is the primary treatment for acute pancreatitis? A. Surgery. B. Antibiotics. C. Pain management and supportive care. D. Insulin therapy. Answer: C. Pain management and supportive care. Rationale: the primary treatment for acute pancreatitis is pain management and supportive care, including hydration. Surgery, A, antibiotics, B, and insulin therapy, D, may be required if complications arise, but are not the primary treatment. 93. Which of the following is a common complication of chronic pancreatitis? A. Diabetes. B. Stroke. C. Heart failure. D. Renal failure. Answer: A. Diabetes. Rationale: chronic pancreatitis can lead to damage to the pancreas, impairing insulin production and leading to diabetes. Stroke, B, heart failure, C, and renal failure, D, are not commonly associated with chronic pancreatitis. 94. Which of the following tests is commonly used to diagnose pancreatitis? A. Abdominal ultrasound. B. CT scan. C. Blood tests for amylase and lipase. D. MRI. Answer: C. Blood tests for amylase and lipase. Rationale: blood tests for amylase and lipase are commonly used to diagnose pancreatitis, as elevated levels are indicative of pancreatic inflammation. Abdominal ultrasound, A, CT scan, B, and MRI, D, may also be used for further evaluation but are not the primary diagnostic tests. 95. What is the main function of the liver? A. Digesting food. B. Filtering toxins from the blood. C. Producing red blood cells. D. Storing fat. Answer: B. Filtering toxins from the blood. Rationale: The liver's main function is to filter toxins from the blood and produce bile for digestion. It does not directly digest food, A. Produce red blood cells, C. Or store fat, D. 96. What is the most common cause of cirrhosis of the liver? A. Hepatitis C infection. B. Alcohol abuse. C. Non-alcoholic fatty liver disease, NEFLD. D. Autoimmune disease. Answer: B. Alcohol abuse. Rationale: alcohol abuse is the leading cause of cirrhosis, although hepatitis C, A, NEFLD, C, and autoimmune disease, D, can also contribute. 97. What is a common symptom of liver cirrhosis? A. Jaundice. B. Shortness of breath. C. Swelling in the legs. D. Chest pain. Answer: A. Jaundice. Rationale: jaundice, or yellowing of the skin and eyes, is a common symptom of liver cirrhosis due to liver dysfunction. Shortness of breath, B. Swelling in the legs, C. And chest pain, D. Can also occur but are less specific. 98. Which of the following is a complication of cirrhosis? A. Portal hypertension. B. Stroke. C. Diabetes. D. Chronic cough. Answer: A. Portal hypertension. Rationale: portal hypertension, increased blood pressure in the portal vein, is a common complication of cirrhosis. Stroke, B. Diabetes, C. And chronic cough, D. are not direct complications of cirrhosis. 99. Which of the following is a common cause of gastroesophageal reflux disease, GERD? A. Helicobacter pylori infection. B. Weak lower esophageal sphincter, LES. C. Excessive stomach acid production. D. Poor digestion of fats. Answer: B. Weak lower esophageal sphincter, LES. Rationale: GERD is commonly caused by a weak LES, which allows stomach acid to flow back into the esophagus. Helicobacter pylori infection, A. Excessive stomach acid production, C. And poor digestion of fats, D. can contribute, but are not the primary causes. 100. What is the primary treatment for gastroesophageal reflux disease, GERD? A. Antibiotics. B. Antacids and proton pump inhibitors, PPIs. C. Surgery. D. Antidiarrheal medications. Answer: B. Antacids and proton pump inhibitors, PPIs. Rationale: antacids and PPIs are the mainstay of treatment for GERD, as they reduce acid production and relieve symptoms. Antibiotics, A. Surgery, C. And antidiarrheal medications, D. are not typically used for GERD.